Hello, everyone, and welcome to one more episode of MetaCast, the podcast of the Meta-Analyses Academy. I am honored today to welcome to the stage Dr. Taniela Bes, who is an internal medicine resident here in Boston, in training in Brazil, being an infectious disease specialist there, and then coming to the United States initially for research, then for clinical training again. She's going to talk about the reasons behind it, the challenges in this journey. So, Taniela, thank you so much for joining. I'm super excited to have this conversation with you.
Good evening, everyone. Thank you so much, Rhanderson, for the invitation. I'm very glad to be here.
Fantastic. Guys, if you're watching for the first time, this podcast, the MetaCast, is the podcast of the Meta-Analyses Academy. The Academy is a training program in systematic reviews and meta-analysis that teaches you how to do effective research with autonomy to advance your career. What we discuss here today is not affiliated with the institutions where we work. You know, I work at Brigham. Taniela works at MetroWest. These opinions here are our own. So, Taniela, thank you so much for joining. Can you introduce yourself and talk a little bit about your journey? Let's start with Brazil. You did internal medicine and residency there. Is that right?
Everything started like in 2012 when I graduated from medical school.
Same year.
So I worked for some time as a primary care physician for a small period of time in the Amazonia area. Then I went to ID residency. In Brazil, we do a little bit differently. We go straight to infectious diseases residency, and we don't do internal medicine before. So after that, I worked for some time as an infectious diseases doctor, and at the same time, I started a PhD program because I was like always super like passionate about research. And during the PhD, I have the opportunity to come back to Boston to do like a research fellow for a couple of years, also at Harvard Medical School, which was like a wonderful experience. Too wonderful that I decided to stay in the US.
Nice. What motivated you to go into infectious disease?
So when I graduated from medical school, I was a little bit unsure about like dermatology, oncology, and ID. So I tried dermatology for some time, but I could not even finish it.
You started residency?
I did.
Wow.
And you know why? Because everything that was very interesting was like referred to ID. So I decided to apply for ID.
Nice.
And then I did ID and it was like a wonderful experience. Like
Great.
I had like amazing mentors.
Then came to Harvard for research. What type of research did you do here? What was that program like?
My main PhD project was like from University of São Paulo. But I always want like to have like an international experience. So I end up coming like to Harvard Medical School to the cardiogenetics lab.
Wow.
To work with Chagas disease. It was like a specific project for chronic immune response in long-term immune response in chronic cardiomyopathy, Chagas cardiomyopathy. So I worked like in the very beginning of the project. The project consists mainly in like immunoprecipitation library built with phages. So when each phage was like expressing one of the trypanosoma cruzi peptides. And so I work like mainly like helping like building this library and start with like the FIP-seq assay, which was like take the patient serums. All the serum came from Brazil and incubate with this library. So now like the project is reaching to an end, but I work like in the very beginning during like my 2 years doing the research fellow.
That's fantastic. Did you enjoy that experience?
Oh yeah, it was wonderful. Wonderful in like several levels. Like I had a chance to work like with wonderful, incredible people, incredible mentors. Dr. Kristen Seidman, she was like an inspiration and always will be like as a doctor, as a woman in science.
Yeah.
And everybody else in the lab.
Nice. And what was the most striking or unexpected to you by doing research here, and also the opportunities for research you had in Brazil? Was it like infrastructure, mentorship? Like what was, or what were the differences between doing this research here and there?
Well, if it's like to pick one thing, I would say founding.
Yeah, the funding, yeah.
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 Well, I think mainly this because in Brazil we have amazing mentors. However, sometimes we lack some infrastructure.
Yeah.
And also the funding.
Yeah, the resources, right?
The resources, exactly.
Yeah, financial infrastructure, yeah. I just recorded a podcast in Chicago with a colleague who presented the SARA trial, a randomized control trial that she self-funded. She paid a full randomized control trial. Her name's Marcelli. I recorded a podcast with her. She self-funded her own randomized control trial.
Oh, wow.
It's unbelievable, the level of dedication, hard work that she did because of what you just said, because of the limited resources for research there. And so you came here. What were the years of your research fellowship? When was that?
2000. Yeah, I came during the pandemic. So
Okay.
I started in 2019 and finished by the end of 2021.
Okay.
So I got the whole pandemic here.
Okay. And then you went back to Brazil and worked there for a little bit?
I went back to Brazil to finish my PhD. And then I ended up coming back to Boston. Because during all this process, my husband ended up transferring his job to Boston.
Okay.
So we had an attachment.
So you had to stay here. Okay, understood.
Okay.
All right.
So and then this was a common decision. We decided to stay here.
And then you decided ultimately to stay. One of the reasons you mentioned was your husband's job. What about in terms of actual work as a doctor? You had already done infectious disease training in Brazil. You had already a PhD. You had research experience here. What motivated you from a career as a doctor to retrain? Is it really just because you had to stay in the U.S. because of your husband had a job here, or is it also that you wanted to be a doctor in the U.S. specifically?
Well, so not at all. I actually I was the one who wants to stay here most.
Okay, got it.
So in the beginning, I thought I could do just research and be happy with that, especially because when I left Brazil at the first place, I was a little bit burnout, working several hours. But with time, I realized that I really like seeing patients. I really like the clinical job. I also like the research part, but the goal is find a way to do both.
Yeah.
But I was really missing the clinical part, and I knew that would be very challenging to go and start residency again, because when I applied, I had 11 years since my graduation. So I knew that would be really hard, but thankfully it worked out.
Yeah, no, let's talk about that. That's an amazing journey from when you have to reapply after having already done residency. In your case, 11 years since graduation from medical school. So can you walk us through some of those challenges, some of those difficulties once you've it's been, I think people use a 5-year cutoff as a long time since graduation. What makes it what are some of the specific challenges in that scenario?
Well, I think you just mentioned one of the biggest. This 10 years, 3 years cutoff. So I was out of all the list just because of that. Also, take the steps. Step one, after
right.
10 years of
everyone,
graduation.
Especially after a long time since graduation. Yeah, for sure.
I didn't even remember where to start studying. So that was another big problem. So I didn't have amazing scores because, I did what I could, but still was not enough. And also to convince during the interviews that even having 11 years of graduation, I still have a lot to learn. And
that you're gonna function well in the role of a resident. I think what program directors are worried about is that you won't, or not you specifically, but that someone with that profile won't fit well into the role of being a resident. So there's a lot of barriers you have to overcome, studying for steps and trying to convince and argue this in the interviews. Let's talk about those specifically. So studying for step one, how long did it take you? And What sort of resources did you use? You just follow the traditional pathway. Was there anything specifically that you used that you thought was helpful?
Well, the first thing I did was like read the books, which, were helpful. But when I start like doing the actual questions, it's like miserable. So the second approach was like start like with the questions, and that was a little bit better.
Yeah, I think most people these days just use the question as the primary resource.
Yeah, I learned for the step 1 and step 3.
How long did it take you, having 11 years since graduation, how long did it take you to study and pass in step 1?
Step 1, I think, took me, I was like doing the PhD with it. So it was not like a full-time study. I usually like study like a couple of hours a day, like early in the morning before starting the day.
Yeah.
And took me like something between like 5 to 6 months.
Yeah. That's very reasonable. Yeah, it's a challenge, but I mean, it's something that you have to get done and get it out of the way. Certainly being step 1 being pass-fail now, helps in that sense. You just have to get across the finish line.
Oh, I think I was one of the last ones who did the regular one.
Yeah, for sure. And then, what about those interviews? How did you communicate that to people that you really wanted to retrain again, and you were willing to go through that grind of being a resident? What was that like, having that conversation?
Well, I really tried to be very honest during the interviews and say, okay, like I never had like internal medicine training. I'm here to learn, and I really want to do this because I really miss to see patients, and there was not like much to make up.
No, I mean, did they ask?
Oh yeah,
yeah, specifically,
all of
like,
them. Why are you doing this again? Like, why? How do you think you function like in a program, being like an intern again?
And then let's fast forward. Now it's been 5 months since you're an intern, since you're a first year internal medicine resident. And what has it been like? How has it been to function in that role?
I'm actually loving it. And I'm very fortunate to be like in a program that everybody is great. Like everybody's amazing. Everybody's super like supportive. The program director, like I have no words to describe him. Like Dr. Treadwell is just amazing. And everybody's like, is always there like to help if you need something. Is it like related like to like a patient case? Is related like to the system? So I think I'm very fortunate to be in the program that I am.
Nice.
That helps a lot.
That's fantastic. And as a first-year resident, have you occupied this position or this role as like an ID, as an infectious disease specialist? Like, do your co-residents or people like, hey, Taniela, she's an infectious disease specialist, we'll just ask her?
No, actually, like rarely, because another interesting thing that I figured out, like I did my ID training at the University of São Paulo, which is like a quaternary hospital. And kind of like everybody who gets there starts with meropenem and vancomycin. So I figured out that I don't really know how to treat like the basic stuff. But yeah, sometimes like we discuss like internally, but most of the time we hear like the ID opinion. And sometimes it's different of mine.
Very good. Very good. So, and you want to apply for infectious disease again as a fellowship here, right? Yes. So 3 years of internal medicine, 2 years of infectious disease?
Yes, that's the plan.
Great. All right. And in your future career, I assume you want to occupy this role of a clinician scientist. Like you want to continue to do research, as you said before. Have you been able to do research even now as a resident or not really?
Well, I'm doing like some with the meta-analyses academy students with the experts group, and also like we are applying for a project in my program for like HIV long-term like isolation, which like the program director is like the PI of the project. So hopefully I'll be able to do some like in like local research too.
Good. Excellent. During your time in that you did research in Harvard and then in Brazil, you always said you had an interest for research. Were you able to publish a lot of papers, or despite the initiative and work and research, not a lot of publications came out of that?
Actually, yes. Like I published like I think like 5 or 6 papers like from my lab in Brazil. I published one big one here, and that is this one from the main project that is ready now and just was submitted. So.
And then in the Meta-Analysis Academy, I've seen some papers that you've published already. Do you remember how many meta-analyses more or less you've had?
Oh, that was like a good question. So we publish like fully like 2. There are like 3 or 4 that are submitted, and we have like a few more like that are like going on. A lot of them were presented in conferences, at least like 10.
That's amazing. I mean, you clearly have a strong research background, and you have the results to prove it, right? You have the publications, you have abstracts presented at conferences. Do you think that these publications were helpful when you applied for residency? Did they come up on interviews? Do you think it was a way to overcome some of the limitations of your applications, like, for example, just how long it had been since you graduated? Do you think the research helped?
Oh, yes. I think, like, at least justify why I was, like, applying so late.
What you were doing in this time?
But, yeah, it's like a few things came up. Like, I was, like, more, like, focusing on a community hospital to do internal medicine. So community hospitals are not like very focused on research. It's most like clinically, but like always like the research part came up like on interviews, and they ask why like specific things about research. Also was pretty good like to connect with like mentors, and even like the experts project, like the meta-analyses were great. Like at least like connect with like my old mentors, and like, oh, hey, I need a recommendation letter now because I'm applying for residency again. Nice. So,
yeah, you mentioned community versus academic programs, but even though obviously academic programs will do more research, generally speaking, I think even in community programs, I think there's a desire, there's an interest in having residents that are capable in research. Those residents tend to be the ones who will match better into fellowship. They do research as a resident, which promotes the program. So I think generally speaking, they still want you to do research.
Yeah, it's just like I'm just trying to like compare like my interviews, like in like community hospitals and academic hospitals. I think like the interviews were like way more like focused on the research part on like academic hospitals. But
how many interviews did you have?
Well, not a lot. I had 4.
4 interviews. Hey.
I applied like for 20 programs. So
just because I suppose the geography, like you.
Yeah, I just apply around here.
Yeah, no, that's pretty good. For interviews, you match, so that's fantastic, and that's what really matters. What do you see as a good recommendation for people who are in that transition from having done residency in their countries or just a long time since they graduated? In addition to the basic things like obviously do well on the steps, and what are there any specific recommendations that you would give for people to be successful like you in applying for the match?
Well, there is no like magic, but I think one single thing that helped me a lot was like try like to get to know the program and try like to get to know like the people in the programs. And I didn't do it on MetroWest, but like in some of the programs I did like some rotations, and this was very helpful, at least like to get like recommendation letters, to get like people to know me and call me for an interview. Okay.
How do you get to know them?
Sending emails, asking to people that I know to connect me, and like
you have to do what you can.
Yeah, exactly. Like expanding the networking.
Nice. Very good. How do you like Boston?
Well, I really like. I'm staying like since like 2019.
Yeah, you're like a native right now. Very good.
Yeah.
Plans to stay here for fellowship too, I presume.
Hopefully, yes.
Yeah, very good. Do you see the community versus academic program for fellowship being an issue, or not really? Like doing a training in a community program when you apply for fellowship?
Well, it may be. I will do my best to overcome it, but so I again, like as I did my previous training in a quaternary hospital, like an academic center, I want to have like this community hospital experience.
Yeah.
So hopefully I will make my way to overcome it and won't be an issue. I don't think for ID it will be an issue.
Yeah, I think I agree with you. It may be like in the most competitive specialties, it may come up, but I know plenty of people who also match really well into competitive specialty coming from community programs. I actually brought up this question, trying to steer it in that direction, in the sense that, obviously a lot of our listeners, a lot of our students, they end up going to community programs, whether out of choice like you, because you wanted to have that experience, whether they didn't match in an academic program. And people shouldn't be discouraged, of course, even to apply for a competitive fellowship. One of our cardiology fellows at Brigham, super competitive cardiology program, one of our fellows came from a community program in Philadelphia, for example. So there's plenty of opportunities even for people who go into academic, for community programs, even in competitive fellowships.
Yeah, even like for the previous residents on my program, they have like a history of great matching, like even like in competitive programs as cardiology.
Great. And then my recommendation for people in that scenario, if you're applying for something competitive as cardiology or GI or oncology, would be to really do a deep dive in research during residency, because that will make a huge difference when you apply for fellowship later on. Very good. Taniela, so in residency, right now, I'm sure you're super busy. Can you talk a little bit about how the meta-analysis specifically allows you to keep active in research, even though you're working probably 1 million hours a week as a first-year resident?
Well, I think like the key of everything is like the amazing students I have. They pretty much do everything by themselves.
But I'm sure you still like help them with the expert eye of an infectious disease specialist.
No. Yeah, like I keep like talking with them on the daily basis, but yeah, they are wonderful. I learn a lot with them.
Nice. So Taniela is one of our experts in the Meta-Analysis Academy. In the experts program, we pair up our students with experts like Taniela in infectious disease, in her example. And then the idea is exactly as she described. The idea is that you would have really strong, well-trained students who will do the heavy lifting of like triage and building the table and doing the statistics and writing the initial draft of the paper. But then also they would benefit from Taniela's expert understanding of infectious disease and finding out which one is a good topic and which one is not a great topic, and also helping with review the paper and all of that. So really serving the role of a mentor. You've enjoyed working with the students?
Yes, of course. Like
group?
one thing that I love is like, for example, like in the past few months, I have like one of my students that he is like from Fiocruz in Brazil. He's an ID resident there, and he wants to go to tropical medicine. So I invite like someone like from London School of Tropical Medicine to be our senior author. I connect them, and they are like
working together.
Yeah, exactly, because like my friend like from London also wants to spend like some time in Brazil. So they are like, so I love this like this connection between like geographies, between like different people that with like similar interests.
Yeah, meta-analysis really make it possible because you don't need to have the patient right in front of you, so you can collaborate from Brazil to Boston to London, as in your case. Good, excellent. Taniela, people are going to be inspired by your story. You know, there's a lot of people, as you know, from Brazil and other countries around the world who want to come to the United States for residency, and they've trained before or a long time ago, or they didn't do residency at first and now it's been 7 or 8 years and they want to come to the United States. Do you have any words of like advice for also weighing the cons, the negative sides, in the sense that now you've been successful, you've invested all this time and energy and effort, and you've been successful. But if you go back, as people are considering this, whether they do it or not, what would you say they should take into consideration in terms of like the negative aspects,
Well, it's really hard like to go into like someone's life and see what's going
personal,
on.
Right?
Exactly. Yeah. This is a very personal thing, but a few things that you have to take into like consideration is like a very expensive.
Yeah.
It's like, thankfully I had like a lot of like support from my family, from my husband, and I could make it. But again, like it's a very expensive process. So sometimes like you have like to live here for some time. You have to do rotations, which sometimes are like paid rotations. Yeah. Thankfully, I never did any of those, but like sometimes is the way to do it.
Yeah.
And
there's no guarantees, right?
Exactly.
That's
and there is no guarantee.
Yeah.
That's the other thing. There is no guarantee at all.
Yeah. Yeah. Having said that, in the moments in my career where I've struggled to make decisions like that, whether I should go and try something really hard or not, or I think that the one question I always ask myself is whether, I what's the potential for regret of not trying,
Right.
So I think this is a question that I get a lot on my social media. People say, oh, I don't know, 35 years old and I'm a cardiologist and I finished residency 4 years ago and things aren't going the way that I expected in India, in Brazil, in Pakistan, like in Colombia. Should I try it or not? Obviously it's very personal, as you said, but in my career, the times that I've had to make difficult decisions like that, I've often gone in the direction of trying. If it's obviously there are many difficulties along the way. It's expensive, like Taniela said, but I tend to be the person.
No, I agree. I'm that kind of person too. I will try.
But
it's very personal.
And tell us a little bit about your global health initiative, about the NGO that you work on.
Well, so I came like from a very rural background. Like I grew up like in a farm. Like I have like a very rural background to a point that when I was like in primary school, I used to ride a horse to go to school.
Nice.
So since like I was like a kid, I always like face a lot of like limitations in healthcare, especially on like the rural side. After graduation from medical school, I worked for some time in the Amazonia area. During residency, I also had a chance to go back there, and I see like a lot of issues, a lot of like referrals that sometimes the primary care providers, which were like early graduate, like someone just coming from medical school. They face a lot of like limitations because I was there, so I had this experience, and this was really hard. Sometimes you refer patients with like no like a clear need for a referral just because you don't have that knowledge to solve the problem.
Yeah.
So this idea, so I always want to do something, and then I met someone that she has this NGO which she started like in Nepal during like a hurricane, like 2009.
Okay.
And she was looking like for a healthcare initiative, and we kind of like matched the ideas, and we start this idea of like a platform, a telehealth platform, which can be run like in remote areas with satellite internet, and this will help like primary care physicians from remote areas. We are like doing like a pilot plan in the like the Tapajós area. It's Amazonia area, but it's in Pará.
Yep.
And also we are looking for do it like in a boat, like a hospital boat that goes through the Tapajós River. And so the idea is like put like a telehealth platform for which like the primary care provider can connect like in real time or a specialist doctor that will be like somewhere else.
Yeah.
And to help like solve like those minor issues that could be solved like inside, like send the patient, which sometimes is like 15 hours by boat to get to a bigger city. Unfortunately, this is a little bit like on pause now because we don't have a lot of funds, but hopefully we'll get back on track.
Yeah, it's such a great project, and you really feel bad for like people who have to go for that, long journey just to get an opinion from a specialist, and because they don't have anyone locally.
Yeah. You are from Brazil too. You know how the things can be hard in remote areas over there.
Absolutely. Also grew up in a farm, by the way. Yeah, in Brazil. Also rode a lot of horses growing up. That's good. So, Taniela, fantastic. You have a really great story. I'm looking forward to the next chapters in your career with infectious disease training here again, and then your career as an ID, as a scientist, as a researcher here. Any final words on just for people who are listening to this and are going to be inspired by your story? Any words of advice or wisdom that you'd like to share with the group?
Oh, well, I think like if you really want this, if you really want to come to the US and do residency again, just go for it.
Yeah.
You'll figure out.
Yeah. Things tend to work out, if you persist long enough and if you try really hard. I fully agree with that. It's like what I said earlier on. If that's someone has the same dream as you of just coming here after having done residency training in their own country, just go for it. Just go for it. Yeah, and try. Obviously, you have to do the financial planning and the timing planning, and how you're going to take care of your family and all these things. But it's I would push for it, Jim. Very good, Taniela. It's great to have you here.
Thank you so much.
Awesome conversation. I'm really honored to have you as an expert in the Meta-Analysis Academy. Congratulations to you and your whole group, of students who've been working with you on your projects. And I look forward to, what's to come next in your career. Congratulations.
Thank you so much. Thank you so much for your support and on the Meta-Analysis Academy.
Very good. Absolutely. So guys, this was MetaCast, the podcast of the Meta-Analysis Academy with Dr. Taniela Bes, who's an infectious disease specialist from Brazil, now training in internal medicine here in Boston, also expert in the Meta-Analysis Academy, leading a group of infectious disease students who've published a lot already in this field. I also invite you to watch the other episodes of MetaCast. For Portuguese-speaking students, we have some episodes that are in Portuguese as well. And also make sure to follow us on Twitter, on Instagram, and join our waitlist if you want to learn how to do meta-analysis and become a part of the Academy. I'll see you later.